Thank you very much, everybody, for joining us today. My name is Dr. Ope Jimmy. I am an obstetrician and gynecologist. Basically, today, we are going to look at the importance of antenatal care. Mon ma yigu yach, omianano be papime, bot one, chok mon ma yigu yach. Kidong, lutiana maguti yon ti yigi, kidong one jumo kaname community. I think that's what we are going to be discussing today. Yes, thank you. We are going to look at importance of antenatal care. I work also for Jowa Medical Center and Maternity Home as a medical director. And for the purpose of this session, I want to clearly disclose that this presentation is sponsored by Jowa Medical Center and Maternity Home, which is found in Gulu City, by Degela Division. And as you are going toward Airfield, it is on Plot 56, Airfield Road. The services, as I have indicated clearly there, those are some of the services we offered at Jowa Medical Center, and we continue to offer them: specialist consultation, antenatal care, delivery, minor and major surgery, laboratory services, ultrasonography, family planning, inpatient care, outpatient care, among others. So there are quite many. In case of any need, you are all welcome. Now, today, we are going to basically look at practical aspects. We very well know that you are all aware of antenatal care. So for the purpose of practical aspect and not to take a lot of time, we are going to look at a brief introduction. Why did we think, or why are we thinking that this aspect of antenatal care is very important? And then we're going to look at a historical background. It's important to know history. It will tell us more of what has been done before and what is yet to be done for us to make sure the future is good. And then the other aspect is we're going to look at how important is this antenatal care in our daily practice, among our mothers, and then among our community. Why are we overemphasizing about the importance of antenatal care? It is quite important, and we are going to look at the importance of the antenatal care. The trend, it is important to appreciate the trend of antenatal care in Uganda. This is to enable us know where we are and where we can be, and what we think can help us move forward. Then we're going to look at antenatal care guidelines and recommendations, the new antenatal care guidelines and recommendations. Of course, we are going to uproot some of the few things that are critical or important for us today. And then I think that preconception counseling, onyo nanane chero kat moko lok mapere tek ne ngwa mai rau ti mane ot yat macharo kwao ka che tawni pe dong omigami nyo nong yai. Those are the few outlines. Now, on the basis of introduction, we look at a study that was done by Peter et al. Peter and colleagues at Makerere University, School of Health Sciences, and by then they did attendance and utilization of antenatal care services, and they did what we call a multi-centers study among upcountry areas. What amazed me were the findings. It's still really appalling to note that health workers play a very great role of about 72.04% compared with the other stakeholders like the media, friends, in creating the awareness about antenatal care. So this has prompted us to say, yes, I think we need to continue playing this role in creating the awareness. And this is what we are doing today. The other thing is that in that study, they also found that there were significant numbers of people who reported that the traditional birth attendants were the reasons why they did not come and attend antenatal, because they were near to them and they were actually accessible. So if they want any advice, they go to the traditional birth attendants which were near to them. Others also responded that their husband were the one to decide. And here we are to empower the husband to allow their wives go and attend antenatal care. The other thing is that they found in that same study is that most of the people who responded, only few reported that they know about antenatal care. Only 37.63%. But also some of the people who responded, they said that there were wrong opinion about antenatal care and the issues of booking. So this study is actually interesting. One more thing that I captured from the study is that there are other stakeholders that play a role in as far as antenatal care is concerned. For example, the religious group or religion of the person, the occupation of the person, the level of education, and even the number of pregnancies that have been carried beyond 28 weeks of gestation. So here is to help us inform the stakeholders how important this antenatal care basis is to our mothers, is to inform everybody that is important for our mothers to go and attend antenatal care once they get pregnant. Members, I request that you mute in case your audio is on. We can't go without appreciating the historical background. Historically, the traditional antenatal care services was developed in the early 1900, and you all very well remember from other history that we studied in secondary about the 1900 issues in Uganda. This during the period when the Buganda Agreement was signed between the British and the Buganda Kingdom. And we still remember this quite very well. So the traditional antenatal care service model was actually developed in that early time. Of course, even before the 1900, we had antenatal care basis, what we call other traditional methods to attend antenatal care, and there were so many. So in the 1900s, these traditional approaches were made, and the model normally assumes that the frequent visits and classifying women into low and high risk to predict complication ahead of time is actually the best way for our mothers and the babies or the fetus. But this traditional approach was found to be lacking in many aspects, and therefore it was replaced by what we call the focused antenatal care. Now, there has been a trend in which this system moves. Initially, it was recommended by researchers in 2001, the issues of goal-oriented antenatal care, but World Health Organization adopted it in 2002. Just to let us know, in Uganda, we have a new revised antenatal care card, and therefore that means that even the antenatal care model has been changed, but actually has been revised to suit our country way of doing antenatal care. And this was revised last year in 2001. Antenatal care is critical. And if this is provided timely and appropriate, evidence-based actions are related to health promotion, disease prevention, screening, and treatment, we will realize that we will reduce the complication from pregnancy and childbirth. And we also reduce stillbirth and prenatal death. Antenatal care is critical once it is integrated in our healthcare delivery system throughout the period of pregnancy. So, as we shall see more, we realize how critical they are when we look at the importance. Now, the antenatal care model provides positive pregnancy experience. Of course, we have the aim is to provide the pregnant women with respectful, individualized, person-centered care at every contact with implementation of effective clinical practices. This includes the intervention and tests. And these are relevant when you provide timely information, psychological and emotional support by our healthcare providers. And this needs a well-functioning healthcare system. Now, before we go further, I would like us to define what is this antenatal care. I am going to be a little bit also speaking the local language to help our other friends who might not be able to pick this very well. Antenatal care is a planned program of medical care offered to our pregnant women by a skilled birth attendant from the time of conception to delivery. That is aimed at ensuring safe and satisfying pregnancy and birth outcome. And this also has been reflected in our revised Ministry of Health maternal and newborn care guidelines of 2021. There are quite many importance of antenatal care. We are going to see them because they are quite important. I want our stakeholders to take note because when we do antenatal care, we promote screening, prevention and treatment of complications during pregnancy. We screen for many diseases. I'll show you antenatal card and we see the area for screening is provided clearly. One of the things that we do screening is we do screening for malaria. Malaria is very common in our region. And so when we screen for malaria and we find it's there in pregnancy because it's treated with a lot of complications, it affects both the mother and the unborn baby. So we need to do this screening. Among other things that we screen include screening for, now we have included other things. We screen for HIV, we screen also for hepatitis B. Now it's included in the revised guidelines. We used not to have them, but we also screen for hemoglobin levels. The HB we screen. We also do screening for syphilis, and if we find, we treat during the pregnancy. So antenatal care, one thing that is also important is promoting the screening and also prevention. In the prevention aspect, we normally prevent malaria by giving patients our fancida that we commonly know. And if we find it's there, we of course treat. We give other preventive therapy, like for example, we also want to prevent occurrence of congenital diseases in early gestation, like, so we give the patients or our mothers folic acid as well. So there are so many things that we do during this process of antenatal. The other thing that I found very interesting is emergency preparedness. We in our community, normally, we don't do much about emergency preparedness because you realize someone gets complication when they're pregnant, they could not come to the hospital. So here we're addressing many delays. The 3 delays commonly that we know. Delay from home in making decision to come to the hospital, delay in providing transport for this patient to come to the hospital, and the third delay is delay at the facility when they reach to get the actual care from the health workers. So our ensuring emergency preparedness covers all this such that at the facility we are ready for any emergency. And then even at home, we are ready with transport. And even making decisions, we are ready and we are prepared. We have some finances to facilitate all these processes. So emergency preparedness is important. And we do this during antenatal care. Promoting birth planning. We plan for our birth. Where do you want to attend antenatal from and where do you want to deliver from is key. Because once you're not ready for where you're going to deliver from, how you're going to attend to delivery, who are the people who are there going to help? Did you organize finances? Birth preparedness plan is key. And it's very important, and we do this during antenatal care. One of the other important things about antenatal care is satisfying any unmet nutritional, social, emotional, and even psychological needs of the pregnant woman. During antenatal care, we normally counsel or provide health education on these areas of the nutrition, balanced diet. We also counsel these mothers during antenatal care, what they can go through, and we therefore allay their emotions that are there, and also enable them to meet their physical needs as a pregnant woman, because here we bring their husband into play to help them meet their other physical needs when they desire. We also provide health education, and this helps us to answer so many questions that these pregnant women may have. Health education includes the signs and symptoms that may be there during pregnancies that these women should not worry. And if they get any, they should actually come to the facility for assessment. Identification of high-risk pregnancies. And also we need to encourage our male partners to get involved. And this is done during antenatal care. Most of the data that has been reported is that male partners' involvement is very low. And so we can strengthen this when these male partners do come for antenatal care in our facilities. We also educate the mothers about the physiology of pregnancy and labor by demonstration. You can demonstrate this using the dolls. You can demonstrate this using charts and diagrams to our mothers when they come to the facility. This also removes the fear and the psychology that pregnancy is always a bad thing. It's a normal physiological change in our body. And so we need to embrace it, and we need to actually help our mothers understand this aspect. And this will help them have satisfying birth, satisfying period during pregnancy as well. We normally motivate these couples about the need of family planning and also appropriate advice to seeking medical care when in case there are some cases where you cannot complete the pregnancy. Others some of them may not be able to counsel them appropriately. And this couple make an informed decision on how to continue with the pregnancy. I brought to your attention the importance of focused antenatal care by trying to compare it with the traditional antenatal care model. Realize that in the previous traditional one, we had so many visits, regardless of the risk of risk status assessment. We had four antenatal care visits in the past, but now I want to usher in that there has been a revised antenatal care recommendations from the past that we used to have 4 antenatal care visits. Now we have 8 antenatal care visits. So I want to go straight to that. This purpose of 8 antenatal care visits has been informed by studies. We have actually found out that women report positive pregnancy experience from antenatal care if a healthy pregnancy or pregnant woman and the baby are prevented from having the risk and illnesses. Kindly members who are having their podium up, please can you mute or actually reduce the Kenneth and colleagues, please can you mute your podium? Yes. Can you mute your podium, please? Thank you. Yes, thank you. So as I was telling you that World Health Organization of 2016 antenatal care model has recommended. Yes, one of them is that kindly reduce the volume. Henry, please. World Health Organization recommends a minimum of 8 contacts. Device that we used to have visits, and now we call it contacts because we want to have interface between our pregnant mothers and then our healthcare provider. In this case, someone who is qualified to conduct antenatal care. Henry, please, may you mute your audio, please? Thank you. World Health Organization recommends a minimum of 8 contacts. You realize I don't call it visits. Now we use contacts because we want an active interface between the healthcare provider and the pregnant woman, including, of course, and the couples. So 1 contact in the first trimester, 2 contacts in the second trimester, and 5 contacts in the third trimester. So realize we normally tell our pregnant mothers to come regularly as followed by these contacts, unless the pregnant woman who normally, if anyone gets complication, you can come at any time, irrespective of the duration you're supposed to come that you are given by the healthcare provider. However, the recommended antenatal care model has 8 contacts, and that's what our country now is adopting, and that's what actually is reflected in our new revised Ministry of Health and Antenatal Care contacts that we should have. This is what I've reflected for you is comparing the old model and the new 2016 World Health Organization Antenatal Care model, where the different contacts are indicated as shown. I think I will not go into that steps. This model actually has been informed by studies that were done. Evidence have shown that when you conduct 8 contacts than just 4 contacts, there has been evidence showing the reduction in in perinatal and improving maternal and perinatal outcome of this pregnancy. We realize that when we have age contact, we are able to identify risks and manage them earlier. We are able to manage and plan for the pregnancies and delivery very, very well. And this has been informed by many studies. Finally, Salpa, please, may you mute your volume? Thank you. As I told you before, the guidelines uses the term contact. As I said, active interface or connection between the pregnant woman and the healthcare provider in order for the quality services to be provided. So that's what we are now using. So we keep talking about contact instead of. I want to actually put this across that World Health Organization actually recommends that at least an ultrasound scan should be done in the pregnancy. It is important for us to assess how the fetus or the unborn baby is. In most cases, people don't go to the facility, but it's important to do an ultrasound scan. And if you have to do only one ultrasound scan, at least it should be done after 24 weeks of gestation. But of course, some people come with their own beliefs that they need to do ultrasound scan every month. Some of these are actually not recommended unless if there is issue or complication that you anticipate. But otherwise, in routine antenatal care, an ultrasound scan can be done before 24 weeks of gestation, and it's recommended for all pregnant women. We estimate the weeks of gestation, and we also detect if there's any anomalies, and we take if there are more than one baby or unborn baby, that's what we call multiple pregnancies, and also it helps us to enhance maternal experience. So this is actually the recommendation in our World Health Organization guidelines. Now, our trend of antenatal care, the trend of antenatal care in Uganda has been really appalling, but we are improving, as it's always said. Attendance by a skilled health provider is actually improving. When we are to see from 2001 to 2016, it has actually increased from 90 to 97%. But we realize that birth occurring at health facilities is not yet 100%. Even birth attended by skilled provider is not yet 100%. So these mitigating factors, the stakeholders should know so that we can actually improve. There are many other factors that affect this, the number of healthcare providers, and also still some community have the traditional birth attendants that are still conducting these deliveries from home. And therefore we are missing some of these cases. And yet if complication occurs, normally we may not be able to help these pregnant women. This is still the same trend, especially the fourth antenatal care visits. Yeah, I'm a little bit faster because we want to make sure we'll be within the time. We normally give some medication, and this will always be given to you. When a pregnant woman comes to the facility, normally they give them this common medicine that I think most of you may know: folic acid, tetanus toxoid vaccine, mebendazole, parasulfate, folic acid sometimes in second trimester, and then of course sulfadoxine, paramethamine, that is the fancida that we call it. So we normally give to these pregnant women. Today, our aim is to look at those important aspects and see how we can improve antenatal care visits by by ensuring that our stakeholders are aware. We do have a lot of health promotion when we are conducting these issues of antenatal care to address the problem involving the husband of these pregnant women. We draw up delivery plan. We discuss family planning, key, and also discuss symptoms of pregnancy losses, and also in case of diseases that occur during pregnancy, preeclampsia, eclampsia. We also educate and counsel on prevention of mother-to-child transmission of HIV and malaria, and also use of insecticide nets, among others. So there are many areas when we're talking about health promotion. One thing that I've chosen also today is about preconception counseling, that people normally don't pay attention to it. This is because when problems start occurring, that's when they start realizing, yes, I think we should have done this. So the objective of preconception counseling is to ensure that a woman enters pregnancy or conceive or get pregnant with an optimal state of health, which could be safe for both ourselves and the fetus, and realize that changes that occur during that time when the woman gets or conceive. So this is actually important because we're going to identify high risk factors before you get pregnant. And when you get pregnant, how could you mitigate these risk factors? And then we also be able to identify the best level health status. For example, blood pressure, we will note it in the conceptual counseling. Someone could be hypertensive but does not know. And we are able to immunize these mothers. We very well know that they offer rubella and hepatitis B immunization in the non-immune women. We also give folic acid. Ideally, folic acid should be started before you get pregnant. Normally, 1 month before you get pregnant or 4 weeks before you get pregnant. But because you don't know when you're going to get pregnant, so when you think you want to get pregnant, it's important for the woman to start folic acid supplementation to prevent the occurrence of a neurotube defect, one of the congenital abnormalities that occur early. We also help these mothers to optimize their preconceptional problem. For example, weight. If you're overweight, you're asked to do exercise to reduce your weight, and this will help us to prevent complications that can occur during pregnancy. And also we allay the anxiety of incoming pregnancy that some people look at it as a psychological torture in women. And we give patient medical education. So I want us to know that the conceptual counseling is quite important because there are some women who are on drugs. So we need to ascertain whether the drug can easily cause problem to the unborn fetus when they get pregnant or not. And women should also be asked to stop smoking because women who are addicted are associated with having complication to the fetus. The fetus may have complication or abnormalities